If you've been struggling with shin pain every time you run, this video is for you. I'm Matt Sigua, a physical therapist, and in this video, I'm going to explain what shin splints are, why they keep on coming back, and how to fix it so you can go back to running pain-free. Let's get started. So shin splints are often described as having like a dull, achy pain in the front of your shins, and usually you'll start to feel them at the beginning of a run. Sometimes they resolve in the middle of the run, but then they'll kind of return and get worse near the end of the run and also afterwards. Shin splints are caused by repetitive overloading of the tibia bone, which is often occurring with running. So one way that you can kind of look at running is it's a repetitive series of single leg jumps over and over and over again from one leg to the other. So that's a lot of impact on the tibia bone. With shin splints, which is also known as medial tibial stress syndrome, there are risk factors associated with the injury. So some of these factors include increased BMI, so BMI over 30. So the more body mass, body weight that you have, the more likelihood that you would develop shin splints with running. Also, sudden increases in your running volume or training. If you went from not running at all and then all of a sudden now you're running 3, 4, 5 times a week, that is a major jump in terms of training volume, which can increase your risk. Also, having a flat foot or excessive foot pronation has been seen to be associated with shin splints. Because this is an overuse type of injury, typically rest and discontinuing running is often prescribed to allow the bone to heal, to allow better recovery for shin splints. However, what I've noticed with a lot of runners who will experience this type of pain is they'll take weeks or even possibly a month off from running. They won't change anything with their routine, and then once they get back into running, they'll start to develop reoccurring shin splints because they didn't address the foundational issues that are leading to the shin splints from occurring. So I'm going to share with you some of the tips that I use personally to deal with shin splints to help you get back to running more pain-free. One of the first things that you can do in the short term to reduce shin splint pain is actually changing the biomechanics of how you're running or your running form. Specifically, what I'm talking about is most people, they'll either land with a heel strike pattern first or they'll land with their toes first. So your foot position changes how much of that load or that impact goes directly into the tibia first. So with heel striking first, when you land with the bottom of your heel, that puts a lot of vertical pressure or impact that goes directly into your tibia, and there's not a lot of dispersion of or like dampening effect of that load through the muscles compared to if you're going to do a forefoot or landing with the toes first. So whenever you land with the heel, you do get your quads, your glutes, and some of the muscles around your ankle to help absorb some of that shock, but you don't get as much of that absorption compared to if you're doing a forefoot or landing with the toes first. So this is one of those adjustments that you don't have to make as a long-term goal. You don't have to change how you run for the rest of your life. It's just in the short term to allow you to keep running today. So switching from a heel strike to a toe first pattern, that's just going to reduce some of that impact on the tibia, and it's going to make your calves work a little bit more, so it's going to decrease some of that shin pain. Another change you want to make to reduce some of the shin pain is modifying your running volume. So for example, let's say if you're running 30 minutes at a time and you're still dealing with this shin pain, what you can do is try to decrease the actual duration by 25%. So if you're running for 30 minutes, try to run for about 22, 23 minutes, because since this is an overuse injury, your body does need that time to rest and recover. So instead of just eliminating running altogether, you can still maintain that level, of endurance and just maintain running, but just lower the duration, lower the volume a little bit. Another tip that can help reduce shin pain with running is one that actually people fail to do all the time, which is incorporating some sort of warm-up prior to going for your runs. Now, regardless if you run on the treadmill or if you run outside, a lot of people will just step out their door and then they just go. What happens is they fail to warm up the appropriate muscles that are required to absorb a lot of this shock that happens when you're doing running, right? So with the warm up, ideally you want to include something where there's like a dynamic type of movement. So That can include doing air squats, so double leg body weight squats. That can be lunges, and that usually I'll do some kind of multi-directional lunge, so doing forward, even backward, and definitely some lateral lunges, just to work your quads, work the hamstrings, work the glutes, get all of those muscles turned on so they're ready to work. You also want to do some calf raises, whether that be double leg or single leg, and we want to work those front of the shin muscles, so your tibialis anterior or your dorsiflexors. So doing some toe raises while you're standing, and again, you can do that single leg or double leg, but the main thing is having some kind of warm up prior to your runs, just to have the muscles ready to work. Now, this is probably the most important tip out of all the ones that I'm going to give you, and this one is actually going to help you the most in the long run. So in terms of preventing shin splints from occurring again, whether that be next season, next year, or years down the line, you have to incorporate strength training into your routine. So we talked about earlier where running is essentially a series of repetitive single leg jumps. So if you think about it, how many of you can actually do a pistol squat or a single leg squat where you're bending down with just the one leg and you're able to maintain the appropriate stability and balance? You're able to maintain appropriate alignment at the hip and knee, so your knee is not caving in, your foot is not collapsing and getting real pronated. So with that, how many times do you think you do a single leg jump over and over in a 30-minute run alone, let alone anything longer than that? So your ability to maintain stability, maintain appropriate shock absorption on a single leg is essential to prevent shin splints from occurring again, and also to prevent any other running related injuries that often occur. So one of the exercises that I like to use is a Bulgarian split squat. So with this, essentially you're working unilaterally or on one side at a time, and you can just prop your leg behind you you can use like a Swiss ball or even like a bench at the gym. So anything that you can just have your back leg elevated, so most of the weight is shifted on the front leg. So using some kind of unilateral movement, such as the Bulgarian split squat, is a nice way to prevent any asymmetries in terms of your strength and stability with the lower leg. Now with this, this is not like a one exercise fits all. One single exercise is not going to develop everything that you need to maintain appropriate running mechanics, maintain longevity with running. But this is just one example that I like to use with a lot of my runners that I work with. All right, guys, good luck getting back to running. I'm gonna leave you with one take-home message, and that's one that I actually learned from one of my professors back in physical therapy school, and that is, you don't run to get fit, you get fit to run. Okay, if you found that helpful, then please subscribe to the channel, and then I'll see you in the next video.